Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long is ringworm contagious? Ringworm is a highly contagious but easy to treat fungal infection spread between animals and humans, with symptoms that typically last up to 14 days. It appears on the skin, hair, and nails in humans and on the skin, claws, or hooves in animals. /r/n/r/n ringworm is contagious during the incubation period, which typically lasts 1 to 3 weeks but may be shorter. Ringworm is not caused by worms. Rather, its name comes from its distinct circular rash that usually makes it easy to diagnose and treat. /r/n/r/n read on to learn how ringworm is contracted, how long it's contagious, and how to prevent spread. /r/n/r/Nailsrnrn Getty Imagesrnrn Ringworm is contagious. There are more than 40 different species of fungi that can cause the infection. There are various names for the condition depending on where the ringworm is located and what species of fungi it belongs to. These include /r/n/r/n. The fungi that impact humans and animals are usually different. Microsporum canis is typically found in dogs, about 70% of infections. Trichophyton is more common in humans. But all fungi species can be spread between humans and animals. /r/n/r/n ringworm spreads through hightouch areas. The fungi cause the infection to survive on dead keratin, the protein found on the top layer of the skin and in hair and nails. Ringworm can also be transmitted through contact with infected personal items, like a sweater or comb, or in wet or humid locations like locker rooms or yoga studios. /r/n/r/n ringworm can spread through skin-to-skin contact. It often appears in open places on the body, like the skin, scalp, and nails. /r/n/r/n Anyone can get ringworm, especially people who work with animals, play close contact sports, like wrestling, or frequently use public showers. Those with weak or suppressed immune systems are more susceptible as well. Other risk factors include /r/n/r/n It's easy to contract or transmit ringworm from your cat or dog, especially if you share blankets or pillows. Ringworm can also spread to other parts of your body. /r/n/r/n The fungi that cause ringworm can live on surfaces. They especially like warm or humid areas, like locker rooms or hot yoga studios. This type of transmission typically shows up in the form of athlete's foot. /r/n/r/n Kittens and puppies are more susceptible to ringworm than cats and dogs. And cats, especially long-haired cats, are more frequently infected than dogs. Farm animals can also pass the infection. /r/n/r/n Not all animals show signs of ringworm, however, they can still be contagious. Ringworm in animals appear as skin patches, circles, and red or crusty rash. Your pet can also get ringworm in and between their claws and nails. /r/n/r/n Your pet may pick up ringworm from boarding, at the dog park, or through any interaction with an infected animal or object. Visit your veterinarian if you suspect your pet has ringworm. /r/n/r/n Ringworm is contagious during the incubation period. You may not have symptoms during this time, but fungi can still be transmitted. /r/n/r/n Once infected, you may feel itchy in 4 to 14 days, in the latter half of incubation. You'll notice a red, scaly, circular rash depending on where the infection is. Sometimes, ringworm on the scalp can cause bald patches. /r/n/r/n You are still considered contagious as long as fungal spores are alive. If the rash is getting smaller, the fungi are dying off. Some medical professionals consider you non-contagious after beginning oral medication, but caution should still be used, especially around sick or immunocompromised individuals. /r/n/r/n Yes, you can be around people who are diagnosed with a ringworm infection. Take steps, though, To ensure that you stop ringworm from spreading, like hand washing and avoiding shared items. r/n/r/n simple hygiene practices can help stop and prevent ringworm from spreading. r/n/r/n if you suspect ringworm, see a medical professional immediately for treatment. r/n/r/n treatment options for ringworm depend on where it is on the body. You may be prescribed topical antifungal cream or ointment for the rash. Antifungal shampoos will help treat issues of the scalp and beard. If the infection is widespread or resistant to topical medication, your healthcare provider may prescribe oral medication. r/n/r/n veterinarians will prescribe antifungal shampoo, creams, dips, or oral medication for pets. It may be hard, but try to handle your pet as little as possible until the infection is cleared. r/n/r/n always complete antifungal medication cycles in full, even if it looks like the infection is gone. r/n/r/n there's a good chance that you may see improvement within a few days, since antifungal medications can work quickly. But full recovery can take a few weeks, and the amount of time ringworm lasts will depend on where in the body you are infected, as well as treatment. Some examples include, /r/n/r/n it's important to treat all the parts of your body affected by ringworm at the same time to prevent lengthy or repeat infections. /r/n/r/n ringworm can go away on its own, but it's not wise to take this treatment route, especially if you live or work with others. Ringworm can cause bacterial skin infections or skin disorders like contact dermatitis if not appropriately treated. /r/n/r/n ringworm is a highly contagious fungal infection that can spread between humans and animals. It typically appears on the skin, scalp, groin, fingers, and toes. Different species of ringworm fungi are found in animals and humans but are still transmittable. /r/n/r/n ringworm is contagious during incubation, about a week after transmission, and as long as the fungi are alive. With proper treatment and hygiene, ringworm can be cleared in about 3 weeks. /r/n/r/n contracting ringworm can be frustrating, and it's easy to feel embarrassed when rashes occur, especially when they are visible on the skin or cause trouble with hair loss. The best way to treat ringworm is to get medication quickly from your healthcare provider, keep the infected area dry, and stay diligent in preventing further contamination. /r/n/r/n ringworm is a common condition and is usually easily treatable. Even if the rash improves, continue taking the medication for the entire course prescribed by your healthcare provider. Feel free to discuss with them other ways to soothe excessive itchiness, if that is an issue. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.